friends, welcome back to Medical Coding with Blue. Today's episode is all about Practicode. Let's just talk about Practicode and what it is and some facts about it. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, first of all, disclaimer first. This is not an ad for Practicode, okay? I am not affiliated with AAPC in any way. I'm not certified with them. But it does not mean that I don't understand what they're saying on the website about Practicode. I have many, many years of experience. I've been a medical coder for 16 years. So I know, based on the feedback of my own colleagues or people that write to me into the show and things like that about Practicode, I have had a lot of people giving me feedback about Practicode and the things that I read online as well. So with that said, this is not a pro or con either way as far as like to get Practicode or to not get Practicode. I have done episodes about Practicode before because people get confused. They think that if you do this, it counts as 1 year of work experience. Practicode does not count as 1 year of work experience. Practicode is considered by AAPC the equivalent of what you would do if you were working your first full year as a medical coder, okay? And so they use this set of records. It's 600 records that you're going to be coding. It's not multiple choice. These are real world redacted records. And you go through and you code these, and you have to pass at a 70%. You get 3 attempts, right, to go through the modules each. And so you have to get 70% in order to pass it. Well, the thing is, guys, when you're doing this, again, AAPC, the American Academy of Professional Coders, is a business. They use this time for you practicing doing a Practicode to take that 1 year of work experience that you're supposed to have for the apprentice status. Because if you do not have previous coding experience and you take the CPC, it has an apprentice status on it for the first 2 years, okay? This just says that you have less than 2 years of experience, basically that you're brand new. Now, if you go through a certain program from AAPC, plus you complete Practicode, that will take off the 2-year work requirement, right? And then you are able to have a full-fledged CPC. But again, having a full-fledged CPC does not mean that you're gonna be a shoo-in to get a job. And for those people that are complaining that, oh, just because I have an apprentice status, I can't get a job, that's a load of garbage, because I know I write resumes and I've written them, not a guarantee, but I've written them for apprentice, CPCA apprentices, and they've been able to get jobs with it. So it is about changing your mindset, and it is about preparing yourself and preparing yourself well, instead of, oh, it's just because I'm an apprentice. I have the apprentice status. Has nothing to do with it. It has everything to do with the skill that you are bringing. Okay, so we'll talk more about that on another episode. But I want to get back to and stay on focus with Practicode. Again, this is not an ad for them. And again, the only reason that I have told people in the past when they say, well, I have Practicode as part of my program, because again, if you complete Practicode, that counts as 1 year of work experience. So even if you have a CPCA and you didn't go through an AAPC program, but you want to take Practicode, you'll only have your apprentice status for 1 year once you've completed Practicode successfully, obviously. And then they'll, once you get your coding job and then you get your experience, then you can get that apprentice status removed. So that's basically what it's for. That's one of the benefits of completing Practicode. Now, I have told people in the past when I've done this type of show that if Practicode was part of your coding package that you bought, maybe you went through the online program for AAPC to get your CPC, and Practicode was part of that package. Some people have said, well, I didn't do it. Well, that's for members, it's a $249 value. If you're not a member, it's $299. So about $300. And to not do that, to not even give yourself the opportunity to at least go through the cases that they have there, whether they are correct or not, just to get yourself practice in there is foolish, and it's a waste of money, and that's the thing that gets to me, is that people will purchase these programs basically just to give up, and it's a waste of money because they heard something that somebody else said. So again, while I agree that there's probably errors, because again, these are written by people, they're human beings. And sometimes stuff gets mixed up, not saying that it's all wrong, but what I am saying is this: just because you're brand new and you think the answer is wrong does not necessarily mean that the answer is wrong. And they do give feedback from what I've said, what I've seen on the description of the thing, right? From the answers, they'll give you the rationale as to why, and that's how you start to learn from there. Now, if you went through a fast-paced coding program, or even if you went through the AAPC self-paced program and you still feel confused, but you basically guessed your way through your CPC exam, and by some miracle you were able to pass, because there are some people that can do that. They can pass based on successfully guessing their way. Practicode is going to show you real fast what you do know and what you don't know, which is also a part of the reason that I say that it's an educational product, okay? And it's going to point out where you're having problems, whether it is problems with OBGYN coding, or problems with injury coding, or problems with cardiovascular coding. You're going to get practice in every single specialty. And that's the great thing about it, okay? So before you say, well, I've been going through this, and it's just it's wrong, and I've been getting credit and blah 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 and yada yada yada. Guys, it is what it is. It is an educational tool. It is a practice thing. It's not meant to be multiple choice. And I think that's where a lot of people get thrown, because it's not multiple choice and they've been used to the multiple choice. But the real world is not multiple choice, and the real world is not multiple choice, and you're never given the answers in the real world. Let me say that again so y'all can hear me. The real world is not multiple choice, and you are not given an answer key for the answers. You have to know, you have to build your skill, you have to practice so that you understand what codes to select and what codes to apply, what codes do not apply. And of course, if you see an error, it's not meaning that the whole thing is bad. It's just an error. It's a human thing. People make mistakes all the time. Even artificial intelligence makes mistakes all the time. So let's not get huffy about the fact that you say, well, I'm a new coder and I demand to have somebody help me. They even say on here in big bold letters, let me read this to y'all so y'all can hear this. The CPCA Practicode Module Overview. This online program allows application of medical coding skills for professional services, physician, mid-level providers, etc., right? And certified medical coders. It is acceptable for non-certified medical coders to take part in this program. And then in big bold letters, it says, note, this program does not teach medical coding. It does not teach medical coding. This is not a coached product. This is what they say. It is not a coached product. So that means you are on your own. Just as, like I said, just as in the real world, where even if you are the only coder, you're the only certified coder in your department, guess what? There's not going to be somebody to tell you, yes, this is correct or not. Now, even when you're submitting claims, right? And you're the coder and the biller submits your codes, because this is what you've selected. You've selected the more specified codes. You've selected the procedures. You've added applicable modifiers. And then they send it in. And then they say, okay, yes, we're going to go ahead and pay this claim. Does it necessarily mean that those codes are correct? No, it doesn't. Because you'll hear about insurance companies that go back years and do audits and say, oh, you know what? This was wrong. You owe us money. So don't just rest on those laurels that, oh yes, they've been paying the claims, it's fine. No, it's not fine. You want to make sure that you have somebody there who is an expert, or somebody who is coming in and double checking just to make sure that everything is correct. Because that's what coding is. That's why I say that this is not as easy as these schools try to make it out to be. These schools are businesses, right? They're a business, and you've got to be able to keep people coming in, even if they have to sell a dream. Okay, because sometimes people don't understand what they're getting into. They just see the money. They just see the glamorous, what they feel is a glamorous side. Oh, that you can work at home, you can work remotely, and blah, blah, blah. And it's not even all about that. It's about the fact that if you're not coding appropriately and claims start getting denied and it's your fault, you're not going to have a job very long. You won't have a job very long. Again, so that's why I tell you guys, you need to study. Even if you're taking this Practicode and you're practicing through it and you say, gosh, I'm really struggling with OBGYN. That's when you need to go back to your workbook and you need to specifically work with those types of encounters, with those types of diagnosis coding, procedure coding. So, and then reading the coding guidelines specific to that chapter. So that way you can see, okay, this is what this means. Okay, now I understand. And then when you're going through Practicode, because you have 18 months to complete it, right? And so you go through that and then, okay, now it's going to start to make more sense. But again, if you're guessing your way through the content and you guess your way through the exam and then you go and you're doing Practicode and you're supposed to be picking up an injury code and you don't know what that 7th character is supposed to be and you don't understand what sequela means, you don't know how to sequence, this is when it's going to show. And you cannot expect AAPC to be there to teach you because, as they say clearly here, this program does not teach medical coding. This is for practice. And again, the reason that I say to go ahead, if you have it as part of your package, to finish it, because you need to get all of the material that you can based on what you paid for. So if you paid for Practicode, you better be trying to complete Practicode, okay? So these modules, they give you attempts to try to pass, but you do need to pass with the 70 in order to get on, and finish the program and get credit, okay? You do need to pass with the 70%. So again, if you are struggling with this and you're seeing, okay, well, this one doesn't make sense to me, or I don't understand why I got this wrong, and if it's telling you the reason why, then you need to look at that and say, okay, this is what they're associating with this, or this is why they didn't select this code or that code, and that's what you need to do. But Practicode is a reflection of your skill as a coder, okay, which is why they give you so many attempts to do it, right, each of those modules. And you can look on the AAPC website under Practicode. And again, people have different opinions about it, how they feel about it. Some people, they do say that it did help them because, again, they're using it for what it's for, to identify where your weak points are at, okay? And if you feel weak in certain areas, then that's where you've got to study more. Because how are you supposed to know where you're weakest, right? At least this gives you a chance to look at an actual record that has been, the private information has been redacted. So you can look at this and say, okay, well, this, and this. So that's how you start to learn. But it does not matter. This is not what employers are particularly looking for, again, because this is just an educational product. So if you don't have the money to take it, it's okay. But again, if you have, it's part of your program, if you paid for it already, then you need to be taking it. You need to be doing it. You need to be completing it. And don't brush it off like, oh, I don't need to. Yeah, you do. Because one of the things that it says is, how many records can you code? They say now you can answer that once you complete Practicode. How many records per hour can you code? That's not really true because every facility is going to be different. Their electronic health record is going to be different. Sometimes the way they have their records set up is going to be different. So you can't really rely on this, but at least it can give you a good idea of what a workday can look like if you're sitting there having to code. And then you can see how many did you get through and how fast did you get through this. And again, that will tell you where your strong suit is at and where your weak points are at. Okay? So like I say, the best thing that you can do is go through it. Don't complain about it. I see too many people wasting time complaining. I had a lady, the same lady, she complained twice. And I told her on the second time, the first time I encouraged her, you know, just keep going through it. She was complaining how hard it was. I encouraged her, told her to keep going, and that it was going to be okay. Just as long as she was working with her book, she would build her understanding. A couple days later, she's over here complaining again. And I told her that I was deleting her comment because complaining is not going to help. So you have to stop complaining. That's complaining is a luxury that you all as brand new students cannot afford, because what is it going to do but waste your energy and waste your time and make you feel bad, make you feel worse. If you are getting to a point where you're getting frustrated with it, you're sitting with it too long. You're sitting with it too long. You need to get up and take a break, because some of you don't do that either. Y'all refuse to take a break. You say, oh, well, I'm just so gung-ho about it and I'm so excited. And then you sit here and you spin your wheels and then you don't understand. And then you want to sit here and complain to the Practicode people and then send these emails not being very polite in some of these. And then, you know, having those people not get back to you, and then you're getting frustrated because you weren't the politest. Okay? So think about how you would feel if somebody, you know, responded to you that way. And if they're not responding to you, think about how many people are sending them messages. And some of these people are not even trying. They're not trying at all. They want somebody to sit here and spoon feed them. And some of you get mad when I say about the spoon feeding part. Guys, this is the reality of the situation. This is what I see, even as a content creator, is where I get people who want to be spoon fed. I'm fairly certain the AAPC folks get the people who want to be spoon-fed as well. People who are not following directions, people who are not reading the guidelines, people who are not reading the scenario out, and they just want to select the correct codes. Again, it is the same thing that's going to happen when you get out in the real world. Some of these codes may be selected, and it may be selected because a provider is using computer-assisted coding, but guess what? Those codes are wrong a lot of those times. The provider themselves may be selecting the codes, but guess what? Also, those codes may be incorrect, because providers are not meant to be coders. Providers are not meant to be coders. So if you're relying on the provider to select the codes, or this is what the provider wants, that does not mean anything if the documentation does not support that code. You, as the coder, have an ethical responsibility to report the correct code. You are considered the subject matter expert, and you better change that code to match whatever's in that documentation. It's not based on what the provider wants. It doesn't matter if the documentation does not support. I'm just saying. So, and then people are saying, well, you know, I just want to shadow somebody in order to learn from them. Again, we can't be doing that. That's why you should not be trying to work for free, because it's a HIPAA violation to have civilians running around in the back looking at records all willy-nilly trying to code it. Oh, well, I just need to get practice. That's what things like Practicode are for. That's what things like workbooks are for. Again, because the format of these health records is going to be different everywhere you go. Epic has a different format. Cerner has a different format. eClinicalWorks has a different format. Everybody has a different format. Okay? And then depending on how the provider is structuring the note, it's different everywhere. But guys, this is not meant to scare you. It's meant to prepare you. So that way you know, as long as you have the basics down, as long as you know where to go, know where to find the answers, as far as like you consulting your guidelines and things like that, or consulting CPT assistant or coding clinic, that's what's going to help you. The Merck manual, using that as well. Those are your resources. So that way it's not going to be so foreign to you. That way you're not having to sit here and struggle. But again, if all you're doing is wasting your time complaining to anybody and everybody who will listen to you about how it's not fair and about how you're getting credit for this even though it's wrong, and the people are not answering you or responding to you, again, you're just wasting time. You are wasting time, and I don't allow that on my channel. The second I see somebody complaining like that, I delete the comment. I do, because you're not going to sit here and spread your negativity on my channel. Again, I have worked very hard to make this community on Medical Coding with Bleu what it is, which is focused on what we have to do. And even though, yes, it comes out a little blunt, and yes, a lot of you don't like it, it doesn't matter. Do you know why? Because it's the truth. It's the truth, and it's direct. It's direct, and it's not wasting anybody's time. So that's what I have to say there. Now, continuing on, it says the program provides 18 months of access from the data purchase. Additional access time can be purchased if needed. Again, AAPC is a business. They're going to make money wherever they can. So you keep that in mind. But again, if you don't have that $299 if you're not a member of AAPC, or if you don't have that $249 if you are a member of AAPC and maybe this wasn't part of your program, if you don't have that money, it's okay. You don't need it. You can still have a CPCA. You could still find your first job. You could still be out there gaining your experience in the real world. It all comes down to your medical coding knowledge. You can get that from working on workbooks. Okay, the workbooks that I recommend are in the description box below. And yes, I do recommend the ICD-10-CM and ICD-10-PCS coding handbook with the answers, even though you have a CPC. And even though the ICD-10-PCS is obviously not covered on the CPC exam, but ICD-10-CM is. And there's lots of scenarios in that book. And then in the back, it's got these little wonderful scenarios. That's why I love that book so much. It's got these little wonderful scenarios, and they're like based in the ER, based in the outpatient setting, that kind of thing. But it is diagnosis coding, right? Because the other side of it is the PCS. You don't have to do the PCS side. Just practice with the diagnosis side of that book, okay? And it's got the answers. All right. And I did update that Amazon affiliate link. So you can look down there and you can see where I put the newest book out there. So that way you can go and find it. If you don't want to go to Amazon, you don't have to. You can go to Barnes & Noble or anywhere that you buy books. All right. You can go on there and find that particular book. You can get the 2025 version if you want to. You can get the 2024 version if you want to. It's going to be the same thing. It's just some of the codes may have updated. That's why I say you can even go as far back as 2022. And you could still use your 2025 code books because you're just practicing. And so if you see that your code is not the same as the code in the book, and you see that book, the code in the book is not in your book at all, then you know that that code has been deleted or updated. And so that way you can go ahead and find that updated code. There's plenty of resources out there to help you with that. But either way that you go, the whole point of it all, guys, is practice. It is practice. And the more practice that you have, the better you'll be prepared for these job assessment tests. And with these job assessment tests for these jobs that you're out there for medical coding, that's going to demonstrate how good you are. Because you could be certified, you could have the best medical coding certification, the CCS. And if you score a 78, they know that you're not ready. You are not ready to be a medical coder in their facility because that's way too low. If you are scoring a 78 on a job assessment test for a job, that is too low. You need to look at what you did wrong, or where you feel like you know that you didn't do that particular section right, whether it was the coding or the basic questions and multiple choice questions. You need to think about, okay, what did I do wrong? And you need to go back and you need to start studying more. And because that's the whole thing too. This is what the thing about the whole thing is this, right? I know I'm getting excited. I'm trying to slow down. Okay. We have all of these things like computer assisted coding. We have like these records that do all these things and things like that, and providers selecting codes and things. But it's all up to us as critical thinkers, as human beings, as medical coders, to make sure that it is correct. Because no matter what, this artificial intelligence, it's taking over. Clearly you don't know. Because artificial intelligence is not correct. It is a dumb product that is only fixed basically by code, as far as like, okay, it's It's somebody in there that's not a coder that's telling it what to do, what to look for, and that's what it's doing. Because again, it's dumb. It cannot critically think. This is why we have jobs as coders. This is why we have to make sure that we are constantly pushing the ball forward and practicing, whether it is going through Practicode, whether it is practicing with workbooks. We need to practice so that way we can sharpen our critical thinking skills. So that way we are showing our skill and why it is important. That's why I don't even worry about artificial intelligence, because it cannot beat my critical thinking. I'm just saying that. Okay. So again, stop complaining about Practicode and just do it. You study for 30 minutes at a time or 1 hour maximum. That's it. Then you take a break, and you take a 15-minute break. You can take a half-hour break, an hour break, whatever you want to do. And then you come back to it. And then you work some more. And then if you see that you keep getting stuff wrong, then go to the guidelines. Look at that particular chapter, whether it's for coding for sepsis, coding for mother baby, any of those things. Go to that particular section so that you know, okay, this is what I did wrong. This is why I'm getting it wrong. And if you immediately think, oh well, it's the thing is wrong. The thing is wrong. The program is wrong. May not always be that the program is wrong. It may be that you're wrong. And if you can't accept that, if you can't be humble enough to accept that now, you are going to be in for a rude awakening when you get out to the real world and you really start coding. So again, accept the explanation of what it is. And again, obviously, if it's wrong and you could prove it and you have a guideline to say that this is the reason for this or whatever, let them know. Okay, so that they can get that feedback and, oh yeah, well, we didn't notice that, or okay, thank you. And then they update it. It's ever evolving, apparently, from what I what I have read. Okay. But again, it says right here, these programs are intended for you to apply medical codes based on the program that you purchase. Assures a broad knowledge in reviewing and assigning the correct procedure and diagnosis codes for medical services. So this is that big practice that a lot of you all are looking for. Okay. If you want to take Practicode, take it. If you don't want to take it and you want to get out there and get your actual experience for those 2 years, and you can save that $299, that $249, that $299 or $249, that can actually go to the purchase of a workbook. If you don't have the Nellie Leon Chisholm book, if you don't have the CPC study guide, which I'm sure you should have the CPC study guide, but at least purchase that Nellie Leon Chisholm book. And that's the one, that's the ICD-10-CM and ICD-10-PCS coding handbook with the answers. That is the best one to learn from, because it's got intermediate scenarios on there. And so it's really good for challenging coders and helping them to recognize those things, because yes, you can learn from books. And if at the end of the day, okay, you are completely stuck and you say, I don't know about injury coding, I need somebody to help me with, specifically with injuries, find yourself a mentor or find a tutor. Okay, tutor, you may have to pay a few bucks for that. Okay, but the reason that you do that is that maybe you need that one-on-one explanation. Okay, and when you do that, when you have that one-on-one explanation, maybe that will help you. But do not ask the tutor to help you with Practicode, because again, Practicode is a judgment of your coding skills, not a judgment of your coding skills plus the tutors or the mentors. Okay, I'm just saying. So with that said, I'm gonna go ahead and wrap this one up. But don't complain on my channel, guys. It's a waste of time. Don't complain. Just do your work. Okay. Find out where your problem is. Do your research so that you can learn. And that's the best advice I can give you. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all again. Bye.